Hi, this is Dr. Song. Welcome to the second video on phaco machine settings. If you missed the first video, click the banner in the top right corner. You can adjust the IOP settings here. You can set the pressure separately for foot pedal positions 1, 2, and 3. With the current setup, the IOP stays consistent at 55 across all stages. You can press this section to switch each foot pedal stage to linear mode. In the current setup, the IOP starts at 20 in stage 1, rises from 20 to 55 in stage 2, and stays at 55 in stage 3. However, with the improved performance of modern machines, it's perfectly fine to use a consistent panel mode with the same IOP across all stages. What's the optimal IOP for surgery? Older phaco machines using gravity-based systems often cause significant IOP fluctuations during aspiration, making anterior chamber stability challenging. However, Centurion's active fluidic system directly compresses the BSS bag, ensuring stable IOP regardless of aspiration flow, which is a major advantage. Therefore, unlike older machines that required high IOP settings to maintain anterior chamber stability, the Centurion system theoretically allows stable anterior chamber maintenance regardless of IOP. This makes it possible to perform surgery at lower IOP levels. With the Centurion machine, IOP can be lowered to physiological levels below 30. It's a well-known fact that low IOP phaco offers several advantages over traditional high IOP phaco. These include reduced intraoperative pain, less BSS turbulence for endothelial cell protection, and optic nerve preservation in advanced glaucoma patients, among other benefits. However, for beginners, low IOP can make the eye too soft, making the surgery more challenging. Start with a setting of around 50 to 60. As you gain experience, gradually try lowering the IOP to explore its benefits. Let's move on to vacuum. Click here to adjust the vacuum settings for each mode. One important thing to remember is that this sets the limit value for vacuum. For flow-based machines like the Centurion, vacuum is generated when the phaco tip is occluded. So the value you set here only applies when the phaco tip is blocked by the nucleus. These vacuum settings are used in chop and quadrant modes. When the foot pedal reaches position 2, the vacuum limit starts at 100 and increases progressively as you press, reaching up to 500. The wide range of adjustment between 100 and 500 in position 2-2 allows for safer handling, even with softer nuclei, when bringing fragments to the center. For beginners, it's a good idea to lower the maximum to around 400 instead of 500 at first. What about sculpt mode? When trenching, high vacuum levels are a no-go, so it's recommended to set the vacuum to around 100 to 130 and adjust it fixed. For cortex mode, you'll need a wide vacuum range, from very low vacuum for the periphery to high vacuum for bulkier cortex removal. Set it linearly from 0 to 500. For visco mode, since fast flow rates and higher vacuum are required, it's good to set the vacuum to higher levels. Now let's move on to aspiration flow. Aspiration refers to how quickly the fluid is drawn in, essentially the flow rate. The flow rate directly impacts the speed of the surgery. A higher flow rate helps pull the nucleus into the tip faster, increasing efficiency, but it also comes with greater risks. On the other hand, if the aspiration flow is too low, the nucleus may not be pulled in effectively. For beginners, this can lead to the phaco tip drifting toward the periphery, which may actually increase risk. An aspiration flow rate of around 30 to 35 is considered ideal. Additionally, it's best to adjust the aspiration flow proportionally with vacuum settings. If the vacuum is low, keep the aspiration low. If the vacuum is high, increase the aspiration accordingly. Maintain the same fixed or linear pattern across the foot pedal stages, with a maximum aspiration rate around 35. Therefore, in the sculpt mode, where the vacuum is set low and fixed at 110, the aspiration should also be lowered and set to a fixed pattern. If you want to increase surgical speed as you become more experienced, you can raise the aspiration in quadrant mode. Based on experience, it's recommended to increase it only up to 1/10 of the vacuum setting. That's it for today's video. In part 3, we'll wrap up with how to adjust Centurion's pedal depth, sound settings, and other personalized configurations and save them. Thank you for watching. Don't forget to subscribe and hit the notification bell.